Miss Edna Monroe, a 75-year-old female who lives alone with her cat in Baton Rouge. She has a pregnant daughter that lives in Florida. Miss Monroe's daughter checks in on her daily, and the Council on Aging picks up Miss Monroe 3 times a week to play cards, eat lunch, stop by the pharmacy, and go grocery shopping. Miss Monroe's hobby is painting. Miss Monroe had a total hip replacement on her left side. Patient education for total hip replacement precautions with a posterior lateral approach include no hip flexion past 90 degrees. You can explain this to your patient as do not bend down to pick up objects from the floor. Do not sit on low surfaces. And by getting them a raised toilet seat, this helps them from breaking their hip flexion past 90 degrees. No hip adduction on affected side. Telling the patient not to cross their legs will help with this explanation. No hip internal rotation on the affected side. Tell your patient not to turn their toes in. While standing, always turn towards the affected side and do not roll in bed. The role of physical therapy includes bed mobility and transfers, gait training with assisted devices, active range of motion exercises, balance exercises, proprioceptive training, and lower extremity circulation. Goals for this video are to outline the safest and most efficient techniques for posterior lateral total hip replacement transfers and to improve interdisciplinary communications by sharing physical therapy's role in patient care. When entering the patient's room, always remember to wash your hands using proper hand washing techniques. Also, evaluate the room and surroundings to check for clues on the patient's status. Prior to starting the therapy session, introduce yourself by giving your name, job title, and purpose for the visit. Prior to touching the patient, get the patient's consent to therapy. Check the patient's pain status and ask when was the last time that they had their medication. 45 minutes prior to a visit allows time for the pain medication to kick in. Here is a PTA student introducing herself to Miss Monroe.
Hi, I'm Sarah. I'm a student physical therapist assistant for Our Lady of the Lake College. The physical therapist asked me to come get you up out of bed. Is that okay with you? Yeah? Okay. How's your pain doing? Are you having any pain?
Prior to getting the patient out of the bed, always check to make sure the bed wheels are in a locked position. Make sure that you ask the patient's permission to undrape them. If the patient gives you permission to undrape them, remove the drapes out of the way so that they do not get in the way of the transfer. Next, go over the hip precautions with your patient. Remember to tell them that no hip flexion past 90 degrees. This can include them bending down to touch the floor or using the restroom without a raised toilet seat. Next, go over no crossing the legs for adduction of the hip. This can include any sitting and crossing the legs or crossing the legs while trying to roll in the bed. For them to be toeing in, make sure that there's no internal rotation going on. Rolling in bed is a contraindication for this.
You cannot flex past 90, so that means you can't bring your knee up and you can't bring your head down. Okay? And that also means you can't, can you see my legs? Okay, you can't bring your leg in past the midline. Okay? And so no crossing your legs, no crossing your ankles, and then you can't internally rotate. So no rolling those feet in towards each other, okay?
Once the patient understands their precautions, give clear and concise instructions on how the transfer will occur. Here, we are going to do a supine to bedside sitting transfer. First, ask the patient to push up with their arms into a long sitting position. Explain to the patient that you will hold their affected leg and move with them as you have them rotate towards the side of the bed. The patient is allowed to use their unaffected side to assist with the transfer. Have the patient move towards the edge of the bed by scooting forward to prepare for the sit-to-stand portion of the transfer. Prior to getting the patient in the wheelchair, check to make sure that the brakes are locked. Remove both leg rests so that they do not get in the way of the transfer. You also want to check the height of the wheelchair to make sure that it does not break the hip precautions for the patient. Adding a pillow will increase the height. Apply a gait belt to the patient to ensure safety throughout the transfer. Ask the patient if there are any lines or tubings that may be occluded by the gait belt. Prior to the transfer, move the Foley catheter from under the bed to the wheelchair, ensuring that the Foley catheter does not touch the ground and any lines or tubings do not get pulled during the transfer. Miss Monroe is weight-bearing as tolerated and weaker on the affected side. She has full strength on the unaffected side. During the transfer, we will guard the affected side in case her knee buckles. Prior to the transfer, explain to the patient that they can push up through their upper extremities and move into standing as the patient counts to 3. You will perform a pivot transfer, continuously guarding the affected side. Then explain to the patient to reach back on the armrest of the wheelchair to assist in sitting. Having the patient keep their affected leg extended helps to prevent hip flexion during seating. Once seated, the leg rest can be placed back on the wheelchair. Prior to transferring the patient back to the bed, make sure that the wheels are locked on the wheelchair and remove the leg rest. Then transfer any lines or tubings back to the bed. Ask the patient to scoot forward towards the edge of the wheelchair to prepare them for the wheelchair to bed transfer. Guard the patient's affected side and ask the patient on their count of 3 to push into a standing position. Using a pivot transfer, rotate the patient towards the bed. Continuously guarding the affected side. Have the patient reach back and scoot theirself onto the bed. For the bedside sitting to supine transfer, remove the gait belt and explain to the patient to use their arms to help push themselves back into the bed. Explain that you will be supporting and moving their affected leg through the transfer to prevent breaking hip precautions. Then have the patient rotate towards the head of the bed. Prior to leaving the patient, make sure the head end rails are up and the head of the bed is at 30 degrees or more. The patient's seat should be lined up with the fold of the bed. Place a pillow or roll between the knees to prevent hip adduction. Leave the patient with a call button for their safety, their tray and reach, and ask the patient if there is anything you can do to make them comfortable.